Buenos días a todas y a todos y
Good
bienvenidos a
morning,
esta
everyone.
sesión virtual
Welcome
de
to
prensa de
this
la
online
Organización Panamericana de la Salud.
press
Yo
conference
soy
of
Ashley Baldwin
Pan
y del
American Health
Departamento
Organization.
de
I'm Ashley
Comunicaciones
Baldwin from the
de la
Communications
OPS.
Department here at
Hoy
PAHO. So
abordaremos el
today
estado
we will
actual de
talk about the present
enfermedades como el
state of
dengue, el
diseases such as
oropouche
dengue,
y gripe
Oropouche,
aviar en las
Oropouche,
Américas.
and
Nos acompañan
avian
los
flu
siguientes
in
expertos:
avian
Dr.
influenza in the
Jarbas
Americas.
Barbosa,
So we
director
have here
de
our experts,
OPS,
Dr. Jarbas
Dr.
Barbosa,
Silvana
Director of PAHO,
Aldiguieri,
Dr. Sylvain
director del
Aldiguieri,
Departamento de
Director of
Prevención,
the
Control
Department
y
for
Eliminación de
Prevention, Control, and
Enfermedades
Elimination of
Transmisibles,
Conveyable
Dr. Andrea
Diseases.
Vicari,
And we
jefe
have
de la Unidad
Dr.
de Gestión de
Andrea
Amenazas
Vicari. He is
Infecciosas,
the head
y
of
la
the
doctora Thais dos
Infectious
Santos,
Threats Unit.
asesora
And we have
regional en
Dr. Thais dos
vigilancia y
Santos,
control de las
Regional
enfermedades
Advisor in Surveillance and the
arbovirales.
Control of
Durante la
Arboviral
sesión, los
Diseases.
periodistas pueden
During
enviar
this
sus
session,
preguntas a
the
través de
journalists
la
can send
función
their questions
Q&A
using the
o
Q&A
levantar la
function
mano
or
para hacer
feature, or can
preguntas
raise their
en
hand
vivo.
to ask
No olviden
questions
decir su
live.
nombre y
Don't
su
forget
lugar
to
de
mention your
ubicación.
name and the name of
Asimismo,
your
contamos con
company.
traducción
We
simultánea
also
en
have
inglés,
simultaneous
español,
interpretation
portugués y
into English,
francés.
Portuguese, Spanish, and
Ahora
French.
le cedo la palabra al
So now
doctor
I'd like to give the
Barbosa
floor
para
to
sus
Dr.
palabras de
Barbosa
apertura.
for his opening remarks.
Gracias, Ashley. Buenos
Thank
días a
you. Thank
todas
you,
y
Ashley.
todos.
Good morning,
Gracias
everyone.
por
Thank you
acompañarnos
for
hoy en la rueda de
joining
prensa.
us today in
Este año
today's press
marca el
conference.
primer
This year
desde
uh,
2020 sin
represents the first
COVID-19
since
como
2020
emergencia de
without
salud pública de
COVID
importancia
19
internacional.
as a public health
Ha sido
emergency
un
of
año
international
valioso en
concern.
los
It has
esfuerzos
been a year
de
of
nuestra región
achievement in our
hacia la
regional
eliminación de
efforts
enfermedades.
toward disease
En
elimination.
2024, las
In
Américas
2024, the
recuperarán su
Americas
status como
regained its
región
status
libre
as
de
an
sarampión
endemic
endémico, con Brasil
measles-free region,
recientemente
with
reverificado
Brazil
como
recently
líder de la
re-verified as
comunidad.
a free of a
Además,
disease country.
Belice, Jamaica,
In
San
addition to this,
Vicente y
Belize,
Granadinas
Jamaica,
eliminaron
and
la
St. Vincent
transmisión
and the Grenadines
materno-infantil del
eliminated
VIH y la
mother-to-child
sífilis.
transmission of
Y
HIV
Brasil
and
eliminó
syphilis,
la
and Brazil
cloaca
eliminated
linfática como problema de salud
lymphatic
pública.
filariasis
Nuestra
as a
región
public
sigue
health
liderando
problem.
en áreas
Our
claves
region
de
continues
salud,
to lead in key
mientras que
areas of
los
health.
casos globales de
While global
sarampión
measles
aumentaron
case increased by
20% en
20%
2023.
in
Las
2023,
Américas fueron la
the
única región
Americas
que vive un
were the only region
crecimiento,
to see a
confirmando el
decline,
número más bajo de
confirming
casos
the
de
lowest
sarampión en
number
la
of
historia,
measles
con
cases in
solo
history
73
at
casos
just
importados de otras
73,
regiones.
all imported from other
Además,
regions. In
la
addition to
cobertura de
this,
vacunación
vaccination
para la vacuna
coverage
contra
for
sarampión,
the
rubéola y
vaccine
paperas
against measles,
alcanzó el
rubella, and the
86%,
mumps
el
reached
nivel más alto
87%, the highest
desde
level
2019.
since
Si
2019.
bien celebramos esses
While we
hitos,
celebrate
também
these
enfrentamos desafios
milestones, we also
importantes.
face significant
Hoje,
challenges.
me gustaría
Today, I
atualizá-los
would
sobre
like
três
to
enfermidades
update
que
you on
atualmente
3
afetam
diseases
a la
which
região
are
das
currently
Américas:
affecting the region of the
dengue,
Americas:
oropouche
dengue,
e
Oropouche, and
H5N1, também conhecido
H5N1,
como gripe
also
aviária.
known as avian
Cada uma
influenza.
dessas enfermidades é
Each of these
única e apresenta
diseases
níveis
is unique
diferentes
and
de
poses a
ameaça
different
para
level
a
of
região.
threat to the region.
Pero existem lições
But there are
importantes de
important
como as
lessons
monitoreamos
in
e
how we
respondemos
monitor
a
and
ellas
respond to them
que podem ajudar
that can help
a nuestras
keep our
populaciones
populations
seguras
safe
agora e no futuro.
now and in the future.
Este año hemos
So this
enfrentado
year,
a epidemia
we
de
have
dengue
faced the
más grande en
largest
las
dengue
Américas
epidemic
desde que
in the
comenzaron
Americas
los
since
registros en
records began
1980.
in 1980.
Se han reportado más de 12,5
More than
millones de casos,
12.6 million
casi
cases have
3
been
veces
reported,
el
nearly
récord
3 times the
establecido en
record set
2023.
in
Más de
2023.
21 mil de esos
More
casos
than
han sido
21,000
graves
of these cases
y
have
se han
been severe,
reportado más de
and more than
7.700 muertes.
7,700 deaths have been
Argentina,
reported.
Brasil, Colômbia y
Argentina,
México
Brazil,
han
Colombia, and Mexico
representado el
have
90%
accounted
de
for
los casos de
90%
dengue
of
y el
dengue cases
88% de
and
las muertes
88% of deaths
relacionadas con
related
esta enfermedad
to
en
this
la región
disease
este
in the
año,
region this
siendo
year,
Brasil el
with
que
Brazil
concentra la mayor parte.
accounting for the
El
largest
dengue
share.
también está
Dengue is
representando un
also
riesgo
posing
mayor de
a
lo normal
higher than normal
para los
risk
niños.
to children.
Los menores de 15 años han
Children
representado
under
más
15
de
years of
un
age
tercio
have
de los
accounted for
casos
more
de
than a
dengue
third of
en
dengue
Costa Rica,
cases in Costa
México y
Rica,
Paraguay.
Mexico, and
En
Paraguay.
Guatemala, el
In Guatemala,
70% de las
70%
muertes por
of
dengue han
dengue
ocorrido en
deaths
niños.
have occurred in
El área
children.
geográfica
The
susceptible
geographical
a la
area
transmisión de
susceptible
dengue
to
también se
dengue
está
transmission
expandiendo
is
en
also
países
expanding
como
in
Argentina y
countries
Uruguay,
such as
en
Argentina and
países que
Uruguay,
no
and in
suelen ser
countries that are
afectados por el
not
dengue.
usually affected by
Eso
dengue.
incluye a los
This
Estados
includes
Unidos,
the United
donde la
States,
mayoría de los
where
casos han
most
sido
cases
importados por
have been
viajeros,
imported by
aunque se ha
travelers.
reportado
although limited local transmission has been reported in Florida, Hawaii, Texas, Arizona, and California. This increase in cases is directly associated with climatic events, including droughts, floods, and warmer climates that favor the proliferation of mosquito breeding sites. Rapid population growth, unplanned urbanization, and living conditions with inadequate water supply, insufficient sanitation, and poor waste management are also driving the spread. Despite these challenges, we are not defenseless against dengue. PAHO's integrated management strategy for the prevention and control of arboviral diseases is an instrument that we have implemented with our member states. It includes vector surveillance, improved case management, training of health providers, and community engagement. The strategy has been instrumental in keeping severe and fatal cases relatively low through better patient management. Dengue vaccines have been introduced in Argentina, Brazil, and Peru. Honduras planned to do so in 2025. While the current dengue vaccine can be a valuable tool for improving community protection and individual outcomes, it will not stop the spread of the virus in the short to medium term, and it does not provide immediate relief during an outbreak. In addition, global supplies for the vaccine remain very limited.
We are all seeing a rise in Oropouche virus across the Americas. Oropouche is a vector-borne virus that has historically been confined to the Amazon basin. But like dengue, cases are now being detected in new areas. This year, 12 countries and territories in the Americas have reported more than 11,600 cases of Oropouche. A majority of cases have occurred in Brazil, with more than 9,500 cases reported. So the Oropouche outbreak is one on a much smaller scale. It requires our attention with its increasing geographic spread. 2 deaths have been reported in Brazil, and the possibility of mother-to-child transmission, including fetal deaths and congenital anomalies, are being investigated. Countries must strengthen their surveillance and continue to share information. We must work across borders to monitor new cases and support health systems to respond. Finally, I would like to update you on H5N1 or avian influenza. H5N1 is a virus most commonly found among birds. However, it's now infecting other species as well, most recently dairy cattle in the United States. In 2024, 58 human cases have been reported in the United States and 1 in Canada. This contrasts with the 3 cases reported in the previous 2 years for the entire region. Animal cases have been reported in additional 17 countries since this outbreak began in 2021. With a moderate number of cases, most of whom have demonstrated occupational exposure to sick poultry and dairy cattle, the public health impact remains limited. Surveillance, including genomic characterization, is crucial to track the virus across species, understand its evolution and risks to humans, and guide our actions. Countries should continue to collect and share information with public health agencies and official veterinary services. Those at high risk of infections, such as farm workers dealing with birds and cattle, must be adequately protected. Intersectoral collaboration on avian influenza is also critical to enable early detection and timely intervention in animals. This year, PAHO convened its 35 member states to establish the Commission for the Prevention and Control of Zoonotic Influenza to bolster cooperation across human, animal, and environmental health sectors. These efforts, under the One Health approach, need redoubling in 2025 and beyond. The Pan American Health Organization, PAHO, is in contact with officials and partners in the human and animal health fields in the United States and Canada to track the outbreak in cows. We will provide guidance for the region as new information becomes available. Finally, disease outbreaks are not new, but the challenges we face today require attention and collaboration. Our region's response to dengue underscores the power of disease surveillance to plan, prepare, and act. While countries share information and coordinate and support disease responses, it saves lives and guides us in tackling the rising threats of dengue, Oropouche, and avian flu. As we address the impacts of climate and health, urbanization, and inequality, PAHO continues to work with every member state to leverage our collective capacity to prepare and respond to current and future health challenges. Thank you.
Many thanks, Dr. Barbosa. We're now going to take some questions from the floor. Ya nos llegó uno de Mauricio Torres de CNN en español y creo que lo va a hacer en vivo. Mauricio.
Hola, muy buenos días a
Go ahead,
todos.
Mauricio, you
Muchas
have the
gracias
floor.
por
Hello,
la
everyone.
información y por el
Thank you very much for the
panel.
information
Tengo
and
un
for
par de
opening this
preguntas
panel.
respecto
I have a
del
few
dengue. La
questions
primera
regarding
es
dengue.
si
The first
la
one
Organización
is
Panamericana
if
tiene
the Pan American Health
algún tipo de
Organization
estimado
has
sobre
some
qué
sort
tanto
of
podría
estimate
crecer
regarding
en
how
2025,
much this
considerando
could
que en
grow in
2024,
2025,
como ya
considering that this year in
decía
2024,
el doctor Barbosa,
as Dr. Barbosa mentioned, we have
la marca de los 12 millones de
gone
casos,
over
12 millones de
the
casos,
recorded
un
12
incremento,
million cases. So it was a
muy grande respecto al
large
2023.
increase
Y la segunda
compared to
pregunta es,
2023. And the second
si
question
hay acciones
is if there
adicionales
are
que los
any
gobiernos
additional
de la región
actions that
puedan
the
hacer
governments in the
para
region could
prevenir
do to
estos
prevent
incrementos. No sé,
such
quizá
increases.
reforzando las
I don't know
vacunas.
if we can
Entiendo
maybe
que como también lo exponía, hay
reinforce
una
vaccination attempts. Also, if
limitación o hay
I
restricciones en
think
el acceso a este
we
tipo
mentioned some
de
restriction to
elementos, o
access
si se
of this type
puede
of elements,
pensar en
or
algún
if we
tipo
can
de
think
medida
about some
alternativa.
sort
Hace
of
algunos días
alternative
un
measure.
investigador de México
A
del
few days
Sistema
ago,
Nacional de
a
Salud
researcher in
Pública decía que
Mexico
podría
from the
explorarse la
health sector,
posibilidad
he
de
said
usar
that we could
radiación para
explore the
convertir a
possibility of using
a los
radiation
mosquitos
to
en
convert mosquitoes
insectos que no sean
in
fértiles o
insects
que no se
that are
reproduzcan
not
tanto.
fertile so that they
Serían
cannot
esas dos
reproduce
preguntas. Muchas
themselves
gracias.
as much. These are the two questions. Thank you very much.
Comenzamos
Thank you,
con el
Mauricio.
doctor
Let's start
Aldigueri,
with
por favor.
Dr. Aldigueri, please.
Sí, muchas gracias.
Yes, thank you very
Mr.
much,
Mauricio Teres,
Mr.
por
Mauricio
pregunta.
Teres, for your question.
El tema de virus
So
transmitidos
the
por mosquitos y por
this
otros
issue
insectos,
of the
hemos hablado también de
insect-borne
Oropouche, es
viruses,
central en nuestro
such as
contexto
Oropouche
americano,
and others, is
contexto de
central
cambio
within
climático,
the American
contexto de
context, due
oscilación
to the
del
context
Niño,
of climate change, also
y también el
because of the
contexto
El
de
Nino
la
climate
cambios,
phenomenon, and
aceleración
also
de la
due to
urbanización
the
en
acceleration of
nuestras
urbanization
poblaciones en las
and these
Américas.
changes and how
Estamos muy
this
sordos.
changes our populations. And in the
Millones de
Americas, we have
personas que
great
superan los 10
major
millones, 12
cities
millones de
that
personas,
have more than 10
y eso
million, 12
aumenta
million people,
riesgos
and this
con
increases the risk.
muchas
And,
oportunidades para
this
mosquitos
provides
de
opportunities
sobrevivir.
for these mosquitoes to be
Como lo
able
explicó el
to
doctor
breed. So as
Barbosa
Dr.
en
Barbosa
sus
mentioned
palabras
in
al
his
inicio de esa conferencia,
opening remarks of this
el año
conference,
2024
in
fue un año
2024,
récord,
this has been a record year,
triplicando, tres
and
veces más
we have
casos en
had
2024,
3
siendo
times more
enfermedades
cases than
comparado con
20.
2023 en efectos de
We had
dengue.
3 times more cases in 2024
Estamos
compared to
hablando de las zonas
2023. So we're
intertropicales
talking
de
about
nuestro
these
continente.
intertropical regions of our continent.
¿Cuántos,
And so
las
regarding
estimaciones,
the
creo que la primera
estimates,
cosa que
I
decir
think that
que
the
no
first thing
tenemos una
that I would
bola de
like to say
cristal,
is that we don't have a crystal ball, right?
pero
So,
hemos observado
but we have
una
seen
intensa y
an
extensa
intense and
circulación del virus del dengue
a
durante el
broad
periodo
circulation of the dengue
2023-2024.
fever during 2023 and
Entonces existe
2024.
una alta
So there
inmunidad
is a high
a nivel de la
immunity
comunidad.
rate at the community level.
Sin embargo, como existen
However,
4 serotipos de dengue,
since we
el
have
cambio en
4
el serotipo, en el
different dengue
serotipo
serotypes, so a
predominante,
change in the
por
predominant
ejemplo,
serotype, For example, the dissemination of dengue serotype 3 in South America. So a change of the serotype can have a significant impact and can create a new risk situation for next year. And to respond to this risk and to prepare ourselves better, PAHO is supporting the countries with information systems that are more strengthened to have early detection. This will focus on genetic molecular characterization of the circulating viruses. We're talking also about genomic surveillance. So this lab platform has been a success in the Americas, and it has been a success in the last few years, especially during the COVID-19 pandemic. And we are now harvesting the fruits of this investment in terms of labs. But the message from the Pan American Health Organization for dengue outbreaks and other outbreaks that are transmitted by mosquitoes is that we always need to prepare ourselves for complicated situations with a possible high impact in the health systems and services. And regarding dengue, our regional goal is to drop down the mortality rate. So a patient that is treated in an early manner and that is monitored closely by health practitioners that are well trained, is this patient should not die from dengue. So I hope this answered the first part of your question. Mr. Mauricio Torres, thank you very much. Thank you, doctor. Now I give the floor to Thais to answer the second part. Thank you. Thank you very much for the question. So the strategy that PAHO has been fostering for the last 20 years is the integrated management strategy, as Dr. Barbosa said. And today we have new technologies, vaccines. We also have irradiated mosquitoes, as you mentioned, and so we are closely watching the evidence and the new interventions available. But these are additional tools that are part of a toolkit that is based on the traditional control and monitoring measures. So this is about having enough surveillance systems with enough resolution so we can identify what are the most severe problems and what areas do we need to prioritize for early intervention. And a legacy from the pandemic has been an improvement in the information systems of the Americas as well as the surveillance systems. So in this way, the vector control systems can work in a more specific manner in these areas where we have a higher transmission of this disease. And in the same way, also, we have clinical management that is crucial to make sure these cases do not become severe cases or deaths. And we can do that when we strengthen the health early care system. And also, this also relates to controlling the cases, which goes beyond clinical management, but also service management. So this is all based on an intersectorial management at the lowest levels in the municipalities and the neighborhoods, so we can make sure the population, the community can reduce these breeding grounds so we can control the vectors to reduce transmission in this way. And of course, working together with the new technologies and vaccines as well, but we cannot forget the basics of our response to these diseases. Thank you very much, Thais. So now we will go to a question that we received by email from Matias Lewy from Medscape in Spanish. And his question is about avian influenza. Since March, the spread of the influenza H5N1, A H5N1 has occurred in dairy cows, and in the region, Mexico, Brazil, and Argentina are the main dairy producers. So the dairy production sector, does it represent an area of greater vulnerability or concern? And does the fact that one or two mutations would be enough to facilitate its spread in humans, does this aggravate the fear? This was revealed in a new study in Science.
British Medical Journal from Luke Taylor, which was to see if we can give some more information on the risk of avian flu in the Americas. The United States has started testing milk and the UK has ordered vaccines. Have countries in the Americas taken similar action? And if not, why? Is the region at lower risk? So I'll give the floor to Andrea.
No, muchas gracias por la pregunta del señor Lowy. Empiezo a contestar en
Thank
español.
you very much. I will start in Spanish, and I will answer this question in Spanish so that perhaps it's easier for us to understand. So I would like to really bring some context to this question. We've seen how avian influenza has spread in the Americas the last few years. So this virus H5N1 has spread, as we have seen, with migratory birds throughout the whole continent. And this has caused also infections also in these birds or poultry, right, in the farms and in other producers. So besides this spread throughout the whole continent, we have seen also what is a spillover spread in other species as well, especially in mammals. Up to 50 species have been reported of mammals that have been affected as well by this spread. So, and of course, we see what is happening also in our dairy cows in the US. We see this manifestation of what is going on, which basically is happening throughout the whole continent. We have seen also marine mammals in Peru, Chile, Argentina that have also been affected in great numbers. So the specificity perhaps of this transmission in dairy cows is essentially that these dairy cows had not been acknowledged before as a species that's susceptible to influenza virus A. So they were susceptible to D specifically, but not influenza A. So this is basically one of these species of mammals, as we said before, that are being affected. And obviously we have seen that this transmission happens through direct contact within the cattle and also due to workers in the sector also, which may be an instrument due to this environment that we see in these production farms. And the other specificity, of course, is what we call the FISMO sector of studies in the dairy cows. So the tissue and the organs that are detected that have been affected as well in terms of milk. So what is important to highlight here as well, and I would say that it's not necessarily only in the sector, but we have this biovulnerability regarding these cattle, and this is a specificity also regarding the situation that we see in the US that led to this situation. It's important to highlight also that there is a significant measure as well to contain, right, this risk of transmission through milk, which is done through pasteurization. So the pasteurization of the milk has been described and used for the last 150 years. This has been one of the great achievements of our public health sector. So it's important to mention that with pasteurized milk, we should not have any major issues of transmission of this disease to people, right? And in terms of scientific publications that highlight what one or another what mutations may happen, it's important to acknowledge that there isn't a consensus from the experts. Some, give more weight to one mutation or another, and others also highlight how after we see this outbreak, or once we see the influenza virus, we also see several mutations. So these mutations are not singular, but they also need to find a balance between themselves, because if they change too much in terms of how they can infect the cell, this can have an impact on how the virus can also leave the cell. So this is a field where we see different opinions. So we don't have a consensus among experts. So it's important to mention that there are several factors that can determine the situation and how this can also affect the transmission along these lines. Thank you very much. And now we go to Associated Press, Dani Kakoto, and he has a question about dengue. What type of strain has been the most common this year?
Vaccines have been introduced in Argentina, Brazil, and Peru, but are those the only countries that have them? If so, are there plans to introduce them elsewhere other than Honduras in 2025? So I'll give that to you, Thais.
Thank you for that question. We have two seasons of transmission in the region of the Americas. The Southern Hemisphere, most of the transmission happens in the first semester of the year. And for the Northern Hemisphere, it happens in the second semester of the year. What we saw in the first semester of the year was dengue 1 and 2 co-circulating in most of the countries for which this data is available. What we saw in the second half of the year in Mesoamerica, Central America, and Mexico, and in some places in the Caribbean, is a predominance of dengue 3, which is new for the region, and it's a serotype that had not predominated for about 10 years. With regard to the vaccine, the WHO's strategic group of experts on the SAGE on immunization practices made a recommendation. This vaccine is most effective on people who have had a first infection of dengue. For most people, that first infection is asymptomatic and it's not severe. What we worry most about dengue is that second infection, when people are much more likely to have severe disease. So as a proxy for that, the SAGE recommended that countries use hospitalization data to see, well, what is the group most affected? Because that group most affected by hospitalization is likely the group that is having that second infection, and then move it back for 2 years, and that's the group you should vaccinate. So that means that the group that countries are vaccinating, even for those countries that are vaccinated, is a limited amount of people. It's children, 10 to 14 years of age. So we're not expecting the vaccine to have a huge impact on transmission at this point. But even so, this is a vaccine that has recently come into the market, and it's still very limited in its supply.
If I may, if I may just to complement that, the PAHO, Pan American Health Organization, through our PAHO's revolving fund for vaccines, we are offering the vaccine to member states that want to introduce them. But as Thais mentioned, this vaccine is not a good one to interrupt the transmission. So it's not good to deal with the outbreaks. The main two tools that we have are still preparing the health services, and the PAHO has a virtual campus. And just to give a figure that is relevant, more than 400,000 healthcare workers addressed the clinical management virtual course that is available. Because as Sylvain mentioned, if we prepare the primary healthcare to make a rapid diagnosis, to offer the proper treatments like hydration and other simple treatments that can be provided at the primary healthcare, we can prevent almost 100% of deaths related to dengue. And the other thing that is important about is vector control. Of course, that the Ministry of Health, local governments play a very important role. But let us remind everybody that more than 80% of the mosquitoes, they are in their households. So if each family receives the proper information to take 15 minutes per week, probably we can reduce a lot the availability of mosquitoes to sustain the transmission in the big cities that you have in Latin America and the Caribbean. Thank you.
Many thanks, Dr. Barbosa. Just a quick reminder, if you have your hand raised in the chat, then please do let us know your name and the media for which you work, and then we'll call on you to ask the question. We've had a question from Blanca Valadez del Grupo Milenio en México. Tiene dos partes. Pregunta, ¿qué tan cerca
So has two parts. It asks how close the world is to a pandemic with related to the avian influenza, and what countries are in a red alert. And then she asks that so the first case of H5N2 avian flu case in Mexico was discarded or ruled out. Can we go on first to Dr. Barbosa to answer this question? Thank you. So I think we always have questions in these press conferences that are questions about the future. And we, although many times the epidemiology, we have to do estimates, right? And many of these estimates, I believe we have to take into account that it's better to prepare for the worst case scenario, right? To be sure that if something happens, we will be prepared. It's not possible to know when this will happen. We know that probably when we look at the last 20 years, so we have the coronaviruses, such as the virus that was responsible for the SARS emergency in 2003, 2004, also the MERS emergency in 2011, 2012, and now we have COVID in 2019, and then the influenza viruses as well as the one that was responsible for the 2009 influenza pandemic. These are always within these most important candidates to be the virus that will produce the new influenza. But this is only some of the other viruses that may arise. So in 1980, no one thought a retrovirus such as HIV could be responsible for probably the largest pandemic that we've had that has such an important impact in the world. So those of us that work with the countries, we are working to implement the lessons that we learned during the pandemic to strengthen our capacities to detect and to respond quickly. Also, our lab capacities, we want to strengthen them, train people, so we can be sure that when this happens, we have a new situation of a virus that may transform itself into a public health emergency of a national, regional, or global importance. At this point, we should have a better capacity to respond to this than what we saw in the last pandemic. I think this is our continuous goal, to be always prepared and to always support the countries so that they can have all the strengths they need to respond appropriately. Thank you. To answer the second part of the question about if this case of H5N2 avian influenza was confirmed in Mexico, and yes, this was confirmed in May of 2024. This is the first case that we saw in humans of H5N2. So this specific combination of what can be this disease in humans. So I want to highlight that this is not necessarily alarming, right? So this is the nature of this virus that we may detect. So this is a virus that it's an avian virus, right? So it's always an avian disease, and also this an avian disease, and it's important also that we always detect this type of virus. So in the last 15 years, so a few times Mexico has reported similar cases. So this is something that is expected, and this also highlights the capacity of the surveillance systems of the countries, in this case, Mexico's surveillance systems, to detect this type of case. It's important also that we may have some sort of investigation, and so we can have a rapid response. And so we have the information that corroborates that this happened in Mexico this year.
Many thanks, Andrea. We've just had a question come in from Andrea Sachs from the Washington Post. Would you like us to give you the floor? We can give you the floor now. And then if not, I'll read the question.
Oh, sure. Hello. Thank you so much for this press conference. As I mentioned in my message, my cousin actually tested positive for dengue when he was in Costa Rica and missed Thanksgiving. So this is important to me personally and also as a travel writer. My question, if I remember what I wrote, one is, what can travelers do before they go into these areas? Is there a map where they should avoid hot spots? Are there areas to depending on this time of the year, just not go to at all? And then once they're in the country, what can they do to protect themselves?
Many thanks for that. Shall I start with Thais and then move on to Dr. Barbosa, perhaps? Okay.
I think that, as with anything, personal risk and travel decisions should be made in consultation with personal physicians. That being said, there are many measures that people can take to protect themselves individually from mosquito bites. If there's no mosquito, there's no dengue. I think this is a mosquito that is known to bite mostly during the day, especially at dusk and dawn. So making sure that personal protective measures such as wearing of repellent, wearing long sleeves and light clothing that cover most of the body, or avoiding areas that are known to be of a lot of mosquitoes, those are all measures that are tried and true to protect oneself from mosquito bites. In terms of transmission, well, that's a little bit challenging because although you could say, well, the region of the Americas has a lot of dengue fever, well, the region of the Americas also has a very strong surveillance system where we know what is circulating there. So I think that, you know, it's not by accident so that we are overrepresented in the dengue case tallies globally. And we also have a culture of transparency where countries are open about their case data and send their information to PAHO for us to report and make that available on the website where you can find case data for all the countries of the region.
Thank you.
No, thank you. Just to add that if you are traveling and feel something like fever, please go to a health facility because it's important to have an early diagnosis for anything, not only for dengue fever. I think that Thais mentioned a very comprehensive response about how you can be protected. And of course, if you have some health condition, talk beforehand with your physician. But if you are a healthy person, don't avoid traveling because traveling is good for our mental health and our personal life. So.
Many thanks, Dr. Barbosa. We have a question, getting a lot of information. We have a question from Belisa Godinho from W Magazine, and she wants to know about H5N1. How does the disease manifest itself in the Americas human compared to animals? And how is it related to climate change? So I'll give that to Andrea.
En español. ¿Era la pregunta? Okay, yes, okay, in English. So as we have seen before, no, most of the cases are really related to H5N1 are essentially related to exposure to farm worker. Either 60% of the reported cases were actually reported in worker working in milking parlors, and the possible way of infection is actually probably, you know, through contact of the infected milk. And so most of the cases were actually manifested in a very mild presentation, mostly with conjunctivitis. So there have been really relatively in young workers as well. So the presentation as well has been in relatively mild. At the same time as well, about 40% of the cases were in workers that participated in the population of poultry farms, where probably the transmission has been mostly by airborne, if you want, as well with contact, and as well these cases have been relatively mild in their presentation.
Many thanks. Sorry, we're having some mic issues. We're having another question from Jermaine Abel from SKN Vibes News in the Caribbean. And he would like to know, do we have country-specific data for the Caribbean region regarding dengue? And with these territories being tourism dependent, there's the possibility of economic disruption. What approach do we recommend for them to take to mitigate potential fallouts and spread to tourists? Thais, you want to start?
PAHO has a PAHO information platform for the Americas named PLISA, from its acronym in Spanish, where this information is widely available to anyone. And it includes information from the Caribbean. As I mentioned, countries in the region share their case data with us, not only for dengue, but also for Zika, chikungunya, and more recently, Oropouche. So that information is available. In terms of economies that are highly dependent on tourism, I think that the strategies for preventing the disease and controlling the disease are not different than from economies that are based on other sectors. I think that the recipe is the same, which is, attempt to reduce transmission, and for those persons that develop the disease, prevent them from becoming severe cases and deaths. I think that I mentioned earlier that we use surveillance data in order to prioritize where we can be most effective in our vector control interventions. And I think that for economies that are highly dependent on tourism, a prioritization scheme might be those areas where tourists are available. But this is not to say that schools, healthcare facilities, and other places should not also be prioritized to prevent the circulation, because if transmission is slowed down in the population in general, it would also be slowed down among tourists.
Many thanks, Thais. We have a question from Violeta Villar de la web de la salud. Desearía saber qué avances tienen de
So
la
I would like to know
enfermedad
what
no
is the progress that we have regarding undiagnosed diseases in DRC and how this affects the Americas. And she also wants to know if the avian influenza can be the next pandemic.
Todavía se están haciendo que lo que son el
So
diagnóstico de esta
we're still
situación,
working on the
todavía
diagnosis
no hay
of
una
this
causa confirmada.
situation in the
Aquí lo que
DRC.
se
There's
sabe
no
seguramente
confirmed
es que
cause yet.
es una
So what we
manifestación
know
más de
certainly is that it is a
respiratoria, que va
manifestation of a
también hace lo que llama la
respiratory
atención
disease.
que la gran
And
parte de
what
los niños
draws our
afectados,
attention is that
de hecho,
many of the
son
children that
niños
are
con
affected
altos niveles de
are children with a
desnutrición.
high level
Entonces,
of
seguramente una
malnutrition.
componente
So this
importante
has been an
de que lo
important
que ha sido
component in
una
what we have
vulnerabilidad
seen,
alimentaria
which
en
is
esta parte
a
del DRC
food
en particular
vulnerability in this
también,
part of the
que
DRC
ha sido
specifically,
afectada también,
which has been
de
affected
lo
as
que puede
well,
ser la situación particular del
which
país.
relates to this
Ah,
specific
por
situation
ende,
in the
no
country.
sabemos en este momento
However,
la
we don't
causa
know
de
right now
esta
what
situación.
is
Esto
causing the
también
situation,
difícil, ha sido un
and
poco
it's also
anticipar
difficult
también un poco
to
puede ser el riesgo
to
al interior del
forecast
continente
the risk
africano para
of
también
how this may affect the
en nuestra
African
región.
continent and how this may affect other regions as well. So we do have intense research that is being done right now by the country and also by the African CDC, and also what is being done in the whole region, also by WHO. And I have a very positive expectation that we will soon know what is going on, so we can also assess this risk much better. So regarding the risk of it becoming a pandemic due to H5N1, which I believe Dr. Barbosa already replied to this issue before. So this is the nature of the influenza virus. It can cause pandemics. So the question is not if, but when, right? When this can happen. And no one has a crystal ball, right, to know when this may happen. And this really highlights the importance of having our surveillance systems always aware and in alert, and also to make sure that we can prepare ourselves for any type of health emergency. So we need to do this every day, because whenever we have an emergency, we have to be ready to face it. Thank you. So just to add to that, because many times I think the journalists perhaps don't know how the system, the surveillance system works. So we do have a global surveillance system that is regionalized. So in the Americas, we have PAHO that is in charge, coordinating the system. And this is based on the international health standards, right? So these are standards that is one of the two of these binding tools that we have to fight for global health. So based on this standard, the countries have to report whenever we have an outbreak or a disease, whether it's known or unknown, that may be a threat. So this is all done in a coordinated manner with all the countries. And even when the country does not report it as quickly as they should, we do have a 24/7 system that searches in social media and in the internet to try to identify if there is any rumor about any disease or outbreak. And then we have a verification process in the country, and then we have research as well, as Andrea mentioned. So I think that it's very important to say that the system works well. And every week in the Americas region, for example, on Fridays, PAHO shares with all the countries of the region, shares a summary of what is going on. And certainly sharing this information in a transparent and objective way is important, to have also a process to investigate, to assess the risks, to see what are the measures that we need to adopt. This is the best protection we can have, because this may provide us the opportunity of having a rapid response to contain any new disease or any disease that may represent a risk to the health of a country, to a risk to the region or the world. Thank you very much.
We've had a question come in from Benjamin, a representative of KOM, a Haitian health media outlet, and he would like to get an overview of the epidemiological data on dengue, avian flu, and Oropouche cases in Haiti, and wants to know what the best strategies to fight against the spread of these diseases are in Haiti. So I'll give that to Sylvain Dr. Aldigueri.
In French?
S'il vous plaît.
Bien, je vais faire de mon mieux. Je vous
Well,
remercie
I'll
pour
do
cette
my
question.
best. I thank you for this question.
La République
And
d'Haïti,
Republic of Haiti
partage,
is
le
sharing
règlement sanitaire international,
within the international
un
health
réseau de surveillance établi,
regulation, all these epidemiological data together with PAHO.
Haïti, pour ce qui est de la
Haiti,
dengue,
as for dengue,
est un pays à risque,
is
tous les
a
pays
risk
ultramarins
countries,
d'insulaires,
as all
risque des autres
other
régions d'Haïti,
island countries for dengue
pour la
outbreaks,
présence du moustique Aedes aegypti,
for the
avec
presence
des
of
antécédents en
the
ce qui
mosquito
concerne
Aedes aegypti.
l'épidémie.
There are
Et nous avons donc,
preceding
une
outbreaks that have
notification,
broken out. So received a
de dengue,
notification from
qui sont
of
confirmées par la
dengue
laboratoire
case,
national
which has
de
been
Port-au-Prince,
confirmed by a national
on peut
health
noter
lab in
l'efficacité
Port-au-Prince
contre des effets de surveillance
with a high efficiency for genomic surveillance. I would like to underscore this. As for the Oropouche virus, or Oropouche, if you spell it another way,
nous avons noté
we
dans la Caraïbe
had
insulaire
noted in the
circulation de ce virus,
island
comme
in
il a
the
été
Caribbean
présenté par le
the
Dr.
spread of this
Barbosa
virus
dans
as
ses
presented
premières
by Dr.
paroles,
Barbosa in his opening
qui
remarks,
s'est
which
disséminé à partir de son
disseminated
lieu
from
initial,
its
qui est le
original
bassin amazonien, ou même le bassin
region, which is the Amazon base in the Orinoco,
de l'île de Trinidad,
and
pour
on the western part of the Trinidad Island,
dans le bassin amazonien,
to
donc
other
en
countries
Amérique
in
centrale,
the Amazon basin, but also in Central America and on the island of Cuba.
on peut dire à ce moment,
So we
en ce moment,
can
que, la
state
République d'Haïti, comme
now that
d'autres
Republic
îles
of Haiti, as well as other
à risque
islands
pour
of the
une
Caribbean,
possible
is
dissémination
at
du
risk
virus
for a
Oropouche.
possible dissemination of the Oropouche virus, which is, but as of now, we have not received any notification by National Health Lab of Haiti about the Oropouche virus. I like to precise that the National Lab in Port-au-Prince has the molecular techniques in order to identify this virus. It is able to identify it. And the same comment applies to the detection capacities of the avian flu virus, H5N1, since we have poultry in family farms in Haiti, where with migrating birds, Haiti is also in a risk area, given the migration, depending on the seasons and the migration of birds, which is the case right now. So as a conclusion, the Republic of Haiti does have surveillance data which are precise within the international health regulation, and they report all events which need reporting, and a lab capacity which obeys to criteria and international standards of the best level. This is what I have to say right now. Thank you, and thank you for having asked this question in French.
Merci, Sylvain. We just have one last question that's come in from Sophia
Dan-
Samantoroy, and she's with Health Policy Watch, and would like to know the status of dengue surveillance and burden in migrant and displaced populations across the Pajo region. What steps is Pajo taking to address the burden of dengue in these groups? Thank you. Would you like to start, Thais? Or?
Dengue surveillance has a long tradition in the region of the Americas. But as it evolves, we realize that there's some data gaps. And a data gap that we have in the region is that many countries do not collect the information as to whether a case of dengue that presents in a healthcare facility is a migrant or is not a migrant. So we don't yet have information to discuss the burden, although some discussions are ongoing, especially in Mesoamerica, as this is a big thoroughway for persons. But you have to remember that mostly the diseases, dengue is a disease that is an urban disease with most of its transmission happening inside of homes. So obviously persons in a situation of vulnerability that are collecting water for their personal use are at a heightened risk of being more impacted by the presence of mosquito breeding grounds and mosquitoes. But, you know, we don't have really data to talk much about this.
Yes, I'd like to add something regarding the many challenges that we have regarding communicable diseases surveillance in migrant population. This is very high in our agenda of technical cooperation with countries, and it's not only limited to vector-borne diseases and arboviral diseases. We are talking about strengthening of surveillance in this region. I'd like to mention and to highlight the importance of the Mesoamerican isthmus from the Darien Gap to southern Mexico. It's also a matter of strengthening the surveillance of malaria. Some countries in Mesoamerica are already, as Belize, as San Salvador, are free of malaria transmission. We would like to assist countries, and we are assisting countries in preventing any reintroduction of malaria that can be also spread through the flow of migrants through Central America. But I'd like also to mention HIV and TB. It's very important that we take into account this migrant population. These are population at risk, living in very vulnerable conditions. So this is one of the topics that we are working very closely with countries in Mesoamerica, and I'd like to highlight the very close work with the government of Panama, including with the Gorgas Institute based in Panama regarding this. Thank you.
So that was the final question. So thank you very much, everyone. And now I'll hand over to Dr. Barbosa for his closing remarks. Thank you.
Thank you, Ashley. But before closing, let me just mention three important things. We had some questions, and in every press conference, we have some questions about how is the situation in my country. We encourage all the countries to share their information in a very transparent way with the press, because the data that we are sharing with you were informed by the countries. So we have exactly the same data than the ministries of health of each one of the countries in the Americas have. But you also can access all this data by country, by sub-region in our website. So please go there that you can have very important information. Second, about Haiti. Sorry, Benjamin, I think that's the name. I cannot speak in French, but besides everything that Sylvain mentioned, also to call the attention that Haiti is still facing a very challenging situation. We have still a cholera outbreak there that we are supporting the Ministry of Health and working both with the national health authorities, NGOs, and others to respond to the to the outbreak and also is struggling to keep the emergency rooms and health services open. One of the only two hospitals in Port-au-Prince that has an emergency room and it's open is almost 100% supported by PAHO, with the support from some donors and stakeholders that are working with us. So it's very important to call the attention about this challenging situation that Haiti is facing, because this is not a responsibility only on the country. I do believe that you need to take this as a common regional responsibility to support people in Haiti to overcome these very serious difficulties that they are making. Tuvimos uma pessoa perguntou, uma periodista, é o sistema que eu já mencionei.
So someone asked about the system that I mentioned, and I think there you can find all the information, but this is based on the international health standards. So up till 2005, the countries were only had to issue reports on 5 diseases. After the SARS crisis, the world saw that this did not establish good conditions to respond to an unknown disease. Because if it was unknown, it was not among these 5, and the countries were not, it was not mandatory for them to share this information. So they changed this international health standard significantly, and they did that this year as well, based on the lessons that we have learned during the COVID-19 pandemic. And some of the important changes that we saw were, one is that now the countries have to report any disease or any situation that may represent a threat to the health systems, or that may spread into other countries, that may interrupt travel, and they may have a significant impact on health. And also that these rumors also could be used to start a verification process. So to call the country and say, well, you have not reported yet, but we have identified in the press, we see this information that there's an outbreak of a certain disease, a hemorrhagic disease, or some unknown disease in your country. So we start a verification process to see what is happening. This is based on this international health standard. It's important to have this, to establish this process of trust and collaboration between all the countries, because to share this information rapidly is certainly one of the best protections that we have for the Americas, but also for the world. So to close this press conference, I wanted to remind you that in today, the 12th of December, we will celebrate the Universal Health Day, which is known as the Day of the Global Coverage of Health. So this date reminds us that this is a right of all of us, not a privilege. However, in our region, 3 of every 10 people face obstacles that make it difficult for them to access health services. These obstacles, they include high costs. We also have the lack of health insurance, difficulty in reaching these health centers, waiting for a long time, and also we see poor experiences when they're looking for healthcare. One of the major problems is out-of-pocket expenses, so what the families need to pay directly for these medical services, medication and treatment. So this is still a huge economic load for so many people and families, and in extreme cases can lead to poverty. We estimate that 133 million people in our region are suffering this issue every year. That's why it's so important that the countries need to invest more in health, and they need to do so in a more efficient manner. It's crucial to strengthen our health primary care. This is key to solve these health issues closely to the communities, to reduce catastrophic expense, and to move forward towards universal health coverage. At PAHO, we recommend that the countries assign at least 6% of their GDP to health, and that out-of-pocket spending should not go over 20%. Even though the countries have put forth efforts to increase their health investments, very few have reached this goal yet. I will continue in English.
We continue to work to strengthen health systems and ensure that all people, regardless of their socioeconomic level, have access to the care they need. The pandemic left us with clear lessons. Investing in health and financial protection is urgent. not only to improve the health of the population, but to strengthen health systems and be better prepared for future emergencies, such as the dengue outbreak we have faced this year. In fact, on December 12th, PAHO will launch a new report titled Progress in Universal Health in the Americas. It highlights the critical role of primary health care in achieving universal health, with a focus on unmet healthcare needs, coverage of essential services, and financial protection. This report will help guide our efforts toward ensuring that all individuals have access to quality health services without financial hardship. Our theme for Universal Health Day this year, Equitable Access with Financial Protection, serves as a call to action. Health should not be a privilege, nor should it depend on the bank balance of each person. It is a right for all. We therefore call on governments to not only guarantee access to health services, but to implement financial protection measures to ensure that the cost of care is not a barrier for those who need it the most. So please read the report. That will be a very important source for all that you want to understand how the health sector is progressing in the Americas and the gaps and the challenges that we have ahead. Thank you.
Bueno, hemos llegado al final de la rueda de prensa de
Very
hoy.
well, we have
Muchas
reached the
gracias a
end
nuestros
of our press
panelistas
conference
por su
for today. Thank you very much to all the panelists for your
También
participation.
queremos
We
agradecer a
also
todos los
would like to thank
periodistas por su
all the
apoyo
journalists
en la
that have
difusión de
been
información
supporting us
clave
in the
sobre
dissemination of
salud
key
para la
information
población en forma
regarding health for our
oportuna y
population
precisa
in
durante
a
este 2021.
precise
Les
and
deseamos todos un
an
próspero
opportune
año
manner
nuevo, lleno
for
de paz y
2024.
descanso.
So we
Por
wish you all a
supuesto, no duden
happy
en
new year,
ponerse en contacto con
full of
nosotros
peace
con
and
cualquier
rest. And
pregunta
please
o solicitud
get in
de
touch with us if you have any
entrevista a
questions
través
or
de
if you
nuestro correo
want any
electrónico
interviews. You can write us to our email, mediateam@paho.org. Thank you very much.